Hi, my name is Nathaniel Ried, Doctor of Physical Therapy and owner of Ried Physical Therapy. So today I want to talk to you a little bit about the shoulder. And what you'll notice is here's your shoulder, and then we've got our shoulder blade here in the back, and then of course your collarbone right there in the front. So we can obviously see this would be like a right shoulder. So people hear about impingement or rotator cuff injuries, really common in the shoulder. So what happens is a lot of times how people get that is that you have basically a bunch of little muscles that come out of this little area here, and there's four of them that are called your rotator cuff muscle. So what happens is whenever you're supposed to try to go overhead with your arm, so if you're trying to get your arm overhead, the scapula is actually supposed to tilt upwards with it, and so that leaves space in between this little area and the actual shoulder itself. Well, let's imagine this scapula doesn't move, and you go up, you're going to go smash right onto those muscles that come out of that area. And then what happens is once you've irritated those tendons, and sometimes it turns into a full tear, and what happens is those muscles irritate, the tendons get irritated, and then you've got the muscles tighten up, you start to get swelling, lots of pain. You even have nerves that come through here, so sometimes the swelling or the muscles can start to pinch some of those nerves, and so you can even get symptoms all the way down to your fingers, numbness, tingling, and then also sometimes pain or loss of strength in one of the muscles, either in the hand, the elbow, or your shoulder. So it's usually very good to, first thing, get everything happy. So at Ried Physical Therapy, we're a one-on-one, hands-on physical therapy clinic. And what we do at Ried Physical Therapy is we've got to calm down all those muscles that sit all around the shoulder. And we've got to get everything back in place and like we like it. We've got to get all the joints moving properly. And there's actually a number of joints that go into the function of the shoulder. It's one of the more complex joints. It also gives us the most accuracy and mobility. So shoulders can be very powerful when they work for us, but they can be a headache when they cause dysfunction. So once we use our hands-on techniques to calm things down, get all the muscles happy, make sure everything's moving properly, then we can use some of the machines to help with the swelling that takes place. And then we've got to realign all of the different things using, again, gentle hands-on techniques. So basically realign it so that everything's in place where we want it. And what happens is we can then, once we've got everything in line, we can gently stabilize it. So while you're working on stability, you can use some tape that helps keep things in line the way you want them. And then also there's dry needling that works really well. You can put it in the exact muscle you want. It's usually pain-free, and most people don't even feel it going in. And so what it does is it brings blood flow to that muscle, relaxes the muscle, and then helps it from not pulling it back out of alignment. So and then also it brings blood flow to cause healing to the area that we want it to go to, because many tendons actually don't get these are ligaments, but many tendons don't get the same exact blood flow that an actual muscle is getting from the body. So once you've gotten everything happy, and then you're working on stability, you've got it stabilized, and then the most important thing is re-educating the shoulder how to move properly. So we use hands-on guiding techniques to really get your coordination back. That's what a lot of people lack after a shoulder injury. Things aren't moving properly, and they keep pinching it like they started off with. And then last but not least, there's a lot of education that goes into this particular condition. Telling people what positions they can get in for pain-free to cause less pain. Telling people how to sleep, what side to sleep on, where to put the pillows, what kind of pillow for the neck, how to drive, what positions to put your hand, all goes into what's going on with this shoulder. So we want to empower our patients so they can get back to doing the things they love to do. So thank you for your time, and call us if you ever have any questions. Thank you.